Today we're going to go through Chapter 2, prefixes, suffixes, and abbreviations. During this course, we're going to talk about some common prefixes used in medical terms. We're going to define common suffixes used in medical terms. We're going to understand medical terms by analyzing their prefixes and suffixes. We're going to practice spelling and pronouncing common medical terms, and we're going to better understand common abbreviations used in healthcare. So, as you learned in Chapter 1, prefixes and suffixes are basic word parts used in most medical terms. So, in this chapter, it includes the most common prefixes and suffixes, and learning these will pave the way for learning medical terms related to all body part systems in later chapters. So you need to know that these word parts are used in most medical terms. And let's go forward and look at some of these. So we learned so far that word parts fit together to form terms. And here we see the prefix dis for painful, the root ur or euro with the combining vowel for urine, and this suffix ia for condition of. So dysuria is a condition of painful urination. Here we have cardio, that's the root for heart, and that's with the combining vowel, with logy, the study of, so we have cardiology, the study of the heart. Again, we have intra, that's the prefix with within, crani or cranio with the combining vowel for skull, and all pertaining to, so intracranial is pertaining to within the skull. Common prefixes that you need to know involving numbers, uni and mono for one, bi and di for two or twice, tri for three, quad or quadra for four, hemi and semi for half, multi for many, poly for many and much. Prefixes involving negation include a or an for without or not, in, im, or non for not, dis for separate or remove, anti or contra for opposing or against, and d for away from, cessation, without. These prefixes involve position, time, or direction, so ex for out of or away from, ecto or exo for outer or outside, en, end, or endo for in or within, sim or sin for together or with, and inter for between. So as we're going through these, make sure that you're practicing the common prefix exercises and in Proctor to you, because this is by no means the all-encompassing list. Again, prefixes involving position, time, or direction, intra for within, sub or infra for below, beneath, supra or super for above, pre for before, in time or space, or post for after or behind, peri for around or surrounding, ab for away from, ad, to or toward, per for through, trans, across and through. These prefixes involve relative characteristics, so normo for normal, hyper, above, excessive, hypo, below or deficient, mega or megalo for large or oversized, or ultra for excess and beyond. We can see here examples that different prefixes change word meanings. So many prefixes express a characteristic that is relative to something else. So relative means there is at least an implied comparison. We've seen some of the relative prefixes in the preceding categories, such as prefixes involving time, meaning this happened before that, or space, this is located beneath that. So in this example, these prefixes describe a quality or characteristic of something compared with the normal situation. So normotensive here, normal is meaning the blood pressure within the normal range. Hypotensive, meaning a lower blood pressure, and hypertensive, meaning an elevated or above normal blood pressure. Additionally, prefixes involving relative characteristics continue to include macro for large or long, micro for small, pan for all or entire, eu for good or normal, dis for painful or difficult, abnormal, iso for equal, alike, homo or homeo for same, alike, hetero for other or different. Other prefixes include pseudo for false, neo for new, re for again and backward, brady for slow, tachy for rapid or fast. These particular suffixes relate to a condition or a disease. So, like prefixes, suffixes modify the meaning of the combining forms to which they're joined. They can be learned in groups based on similar or opposite meanings, and you'll see some of that in the book. And almost all medical terms have a suffix. And suffixes and a combining form usually form a noun or an adjective. So some common suffixes related to conditions or diseases include ism, ia, and y, a condition of, osis, an abnormal condition, algia, a pain, emia, a condition of the blood, itis, an inflammation, megaly, an enlargement, oma, a tumor, pathy, a disease, and rhea, a flow or discharge. Suffixes related to surgeries are centesis, a puncture to aspirate, an ectomy, an excision or surgical removal, plasty, a surgical repair or reconstruction, suture is a raphe, stomy, a surgical opening, or tomy, an incision. Other common suffixes that you're going to see is ik, ak, al, ar, ere, or us, which refer to pertaining to. Genic or genesis is that refers to originating or producing, and gram, record or recording. Other suffixes commonly seen are graphe, a process of recording, eum, a tissue or a structure, logist or ist is one who specializes in, logi, the study of, meter, an instrument for measuring, oid for resembling, ol for small, scope, an instrument for examination, scopi, a process of examining or examination. When we talk about common abbreviations, there is a standard of commonly used abbreviations in healthcare. The reason for this is it saves time for busy practitioners. They're very convenient but prone to misinterpretation. The Joint Commission, that's the body that regulates healthcare, has a do not use list of abbreviations that must never be used. This is located in Appendix D in the text. This is a do not use list. And the reason for this is because these particular abbreviations are most commonly misinterpreted and have led to many medical errors and deaths. Each facility that you go to, a healthcare facility, usually has a list of their own do not use or use abbreviations. So be sure to find out what those lists are, what should be avoided, and what's acceptable. So some common abbreviations are PT for patient, H&P for history and physical. That's typically the doctor's history and physical examination. HX for history, SX for symptom, DX for diagnosis, PX for prognosis, TX or TR for treatment, RX for prescription, MD for doctor of medicine, DC, doctor of chiropractic medicine, DDS for doctor of dental surgery, OD for doctor of optometry, OBGYN for obstetrics and gynecology, ENT for ear, nose, and throat, PEDS for pediatrics, a PA for physician's assistant. ICU is the intensive care unit, ER, ED, emergency room, emergency department, PT, physical therapy, CAM, that stands for complementary and alternative medicine. Units of measure, these are really important to know. So M, cm, mm, meter, centimeter, millimeter. Uppercase L, ml for liter and milliliter. G, gm, mg, kg for gram, milligram, kilogram. cc for cubic centimeter. Additionally, units of measure include OZ for ounce, C for Celsius or centigrade for temperature, F for Fahrenheit for temperature. Prescriptions, or these are commonly seen in medical records, BID for twice a day, QID 4 times a day, NOC for night, PC for after meals, PRN as needed. Other common abbreviations include NPO for nothing by mouth, so donate or drink, RBC, red blood cell, WBC, white blood cell, ADL for activities of daily living, or sometimes ADLs, STAT for immediately, AP for anterior-posterior from front to back, lab for laboratory, CT for computed tomography, a type of x-ray, and MRI for magnetic resonance imaging. HT for height, WT for weight, pre-op or pre-op with a dash for preoperative before surgery, post-op or post-op with a dash for post-operative or after surgery. BS, vital signs, BP, blood pressure, and you can see that these are uppercase. Uppercase T for temperature, uppercase P for pulse rate, uppercase R for respiratory rate. And that's the end of the show. So be sure to go through this and get real familiar with abbreviations and all of the information in the chapter. Practice in your prep U and take your Chapter 2 quiz.